very good evening. So this is a commitment which we are going to be talking about. As most of you are aware that this is the silver jubilee year of the Adolescent Health Academy. 25 years of hard work, our chairperson, Professor Himabindu Singh, as the chair in this silver jubilee year, has decided, this is entirely her brainchild, that not only should we be working amongst ourselves, but we need to reach out to a larger community. And once we are talking about the larger community, it has to be by joining hands with organizations who are all stakeholders in adolescent health. Towards this particular purpose, the Hyderabad Declaration on Adolescent Health was a national commitment by India's professional organizations that we would be celebrating the 18th of every month as the Adolescent and Youth Wellness Day. We shall collectively reach and empower 1 million adolescents, and this was released on the 12th of July 2025. National Presidents of the Indian Academy of Pediatrics, we expect Dr. Vasant Khalatkar to join us any moment, the Indian Medical Association, the Federation of Obstetric and Gynecological Societies of India, the Stillbirth Society of India, who have their representatives here, the Indian Association of Preventive and Social Medicine, the Indian Public Health Association, and of course, our chairperson of the Adolescent Health Academy were the signatories. So this declaration, which was developed through multiple consultations, is a reiteration of the commitment that we have towards adolescent health. Today, on the occasion of the Silver Jubilee ADOLESCON of the Adolescent Health Academy, we will reiterate this commitment in a step forward through very concrete steps that each of the organizations will be outlining. For this, we will have a short panel discussion, and may I invite on stage Professor Himabindu Singh, the chairperson of the Adolescent Health Academy. A round of applause, please. We also have Dr. Rachna Kathuria, representing the World Health Organization. A round of applause for Dr. Rachna, please. We have Dr. Joe Amalan. Joe, I did see you around. Dr. Joe Amalan. Sorry. Dr. Navya will be joining from the State Adolescent Health Resource Center of AIMS Mangalagiri, who are one of our coordinators and partners along with UNICEF. We shall have Dr. Neelam Agarwal, the President of the Stillbirth Society of India. Welcome, ma'am, and a round of applause for her, please. We shall have Dr. Santwan Mehta. Welcome, Dr. Mehta. He is representing the FOXY, that is the Obstetric and Gynecological Society. We very, very warmly welcome Dr. Kadri, who was here dot on time, and he is the past president of the Indian Association of Preventive and Social Medicine. And we are also very, very proud that we have been joined online by Dr. Dilip Bhanushali. We have been joined by Dr. Vivek Singh from UNICEF. We have also got Dr. Salima Bhatia from UNICEF online. So thank you very much for joining us today. We are waiting for Dr. Vasant Khalatkar to come and join all of us. Thank you to all the dignitaries and extremely sorry for the delay in starting the proceedings. So we shall now hand over to Professor Hima Bindu Singh to give us an introduction to the Hyderabad Declaration and what we have achieved from the 12th of July till date.
A very good evening to the all respected dignitaries on stage, and also we have virtually we have dignitaries from UNICEF and other organizations. I can see Dr. Vivek Singh here. Good evening, Dr. Vivek, representing UNICEF. Thank you for joining with us on this National ADOLESCON, and to your showing, it shows your commitment in spite of your busy schedule. It shows your commitment of taking this agenda forward. I also see other organizations, heads here, representatives, and Dr. Bhanushali, Dilip Bhanushali from IMA, he's also promised his commitment. And Salima, thank you for being with us. This whole idea of youth wellness, this was an idea that this year AHA Adolescent Health Academy was celebrating the Silver Jubilee year, 25 years of existence of our dedicated academy for who's working for the adolescents and the young people. I think this is a very important agenda not only for Indian Academy of Pediatrics, for many organizations, including UNICEF, WHO, FOXY, IMA, and all the PSM, etc. So we all thought that this year, while we are celebrating the Adolescent Health Academy was leading this campaign of empowering Yuva. And we were celebrating the 18th of every month as a Youth Wellness Day to make the youth, we said wave, we said well, adolescent, vibrant, and empowered. So we expect that while empowering our youth on 6 priority areas, that is on sexual wellness, metabolic wellness, mental wellness, road safety, vaccinations. So there were 5 to 6 priority areas. We took this up as an agenda, and we had a training of trainers module at the National IAP conference at Hyderabad. And after the TOT, we started celebrating the Youth Wellness Day, 18th of every month. And we had young people, we engaged them. It was their, we took their perceptions into our, whatever we are doing, ki unko kya chahte hain, what they want from our AHA pediatricians, because it's not enough that we discuss amongst ourselves that about the different modules we do. We are doing a lot of work. We are actually doing capacity building of our pediatricians since long time on various issues. But these, I think the young people want us to empower them on mental health issues or even sexual reproductive health issues, but how to speak about these issues to them, what exactly they want us to do. So these perceptions were very valuable. And this, keeping that in mind, we had them engaged through this Wave 18 program. So they were leading the program. They were like change agents for us. And UNICEF has come in a big way. I really thank Dr. Vivek Singh. And he's actually with us for all IAP activities. So we really salute you and appreciate you, Vivek Singh. A big round of applause to him. And also our Syed Hube Ali. He's the adolescent expert in charge for the UNICEF from India. And he and, of course, my friend at Hyderabad, Salima, I just can't stop taking her name. She was the one who, we just sat in Hyderabad and we thought that let us do this big. And Syed Ali has actually supported our program. And we are also doing 6 youth consultations across India. We had conducted this youth consult. We invite Dr. Vasant Khalatkar, our president of IAP, on stage. Thank you, Dr. Vasant. Our mother organization, IAP, and we are very thankful for your presence here. And we are all together here to show our commitment for this program ahead. And I was just saying how this whole concept has developed. So this Empower Yuva program and the youth consultations have happened already in Ludhiana during the North ADOLESCON. We had in Central ADOLESCON at Hyderabad. We also had at Kolkata. And now we are planning at Mangalore for the South. And the national conference, which is happening at Ahmedabad, has brought us together physically. So we had a virtual meeting on June 12th. Some of us were online, some of us were offline. And we had declared and signed this commitment that about 2 to 3 things. One is to celebrate 18th of every month as the Youth Wellness Day. And second is to start some UA clinics or some AHA resource centers in medical colleges or in some place, wherever we can, so that we give them some places where to go. We are doing so much capacity building, but where the adolescents should go, where are the centers, where are the resources? I think we all should work towards this. So with these two commitments, and I think we thought of a little, maybe it is a little big, but I'm sure we can all do together. If all of us join hands, we can definitely reach out to 1 million adolescents this year. So that is the commitment. All the presidents have signed this document, and I'm really happy during my tenure and during my chairmanship of AHA, that to a silver jubilee year, this landmark event is happening where IAP and FOXY, IMA, and all the other organizations have come forward to sign this declaration. And I'm looking forward for each organization to orient their branches about this Hyderabad declaration and to also have some plan which we will discuss now shortly, how we want to take this Hyderabad declaration forward. Thank you for giving me this opportunity. I would like Dr. Vasant Kalatkar to be the chair for this discussion, and the IAP from the IAP, and maybe invite him, Dr. Shamik.
Thank you, Dr. Kalatkar, for having joined us. You will be chairing the session. Uh, Before I proceed, can I just acknowledge the presence of Dr. Rajiv and Dr. Aarti from AIMS Mangalgiri, who are one of our key resource persons and partners. I also acknowledge the presence of Dr. Srirang Apkari from the Indian Medical Association. Dr. Bhanushali was also due to join us, but due to his prior commitments and the delay we've had, probably he hasn't been able to join. Thank you very much, Dr. Apkari, for representing the IMA. We now move on to the further concrete actions that we would be expecting from the various organizations. And in this respect, since we've kept him waiting for very, very long, I would first request Vivek Singh from UNICEF to please put in his few words.
Thank you, Dr. Sharma. Can you confirm if I'm audible?
Yes, you are.
Thank you very much. And good evening to the President. I can see Dr. Vasant Kalatkar there. And to the chapter chairperson, Dr. Hinadandu Singh. And of course, all the other colleagues, the dignitaries on the desk and off the dais. First of all, Dr. Hinadandu is being generous. I must mention that it is their tenacity, especially she and Dr. Salima, that they have pulled me out of. I was on the road, and I hope it is not disturbing. I could find a cafe somewhere, but the amount of efforts this chapter has put in, and with a very clear goal of bringing together all the agencies towards this goal of reaching these many adolescents, I want to make 2 points from the perspective of UNICEF. We keep saying that we have 2 opportunities for children to thrive in their lives, and that is the early childhood days. We know what happens to our cognitive development with the babies in the first 1,000 days, and then we know the socio-emotional and the recent plans of series of the next 1,000 days. The only other opportunity we get, these are the foundational days of the first and the next 1,000 days. But how healthy the individual will be, how resilient and strong the individual will be, how purposive in their life these individuals will be, is decided during adolescence. And that's the second window when you're actually having a child go on to the adulthood. So for all of us as pediatricians and those who know about these early childhood days, we also know that the only other opportunity we have is in the adolescent. So in short, if the first 1,000 days is for survival, I would see adolescence as the period for success as individuals. And what I would only say is that I've been very closely observing what this chapter has been doing. it would have been very nice. And I am taking cue from some of your sessions here that you're engaging youth. So for monitoring reaching of these 1 million youth, Dr. Hima, if it should be a small group, I see AIMS will be also being represented. So if you were asking about these clinics, RKSK or the school health program, if we can have government also across states and union in this partnership where we can have a monitoring mechanism also of what the youth would do, because we have about 250 million youth in the country. So how these 1 million that you reach, how they can further catalyze this change for the entire 250 million. So I'm hoping to see more and more such engagements. I was observing in the previous session also that we will speaking. If you can have more people engaged, and especially because when you talk of child rights and the Convention of the Rights of the Child, all the rights which Government of India being a signatory also gives to its children are grouped into 4 categories: for survival, for development, for protection, and for participation. And I think this participation of children in efforts towards ensuring their rights is where we can engage more and more adolescents. So very welcome step, but as I said, bringing all the agencies together and for their commitment. And we should not lose sight of this secondary opportunity and should in fact be advocating with the same level of excitement and commitment as the early childhood development days for solid human resource foundation for the country, and also aligning to some of the goals, aspirations that the country has through this. All the best, and thank you for ensuring that I come for the second of the Day on Dr. Salima.
Thank you for your very, very encouraging words of commitment. Once an ally, forever an ally from the UNICEF. Thank you, Dr. Vivek Singh. We now would request Dr. Rachna Kathuria from the World Health Organization to talk about the global best practices of adolescent health and development.
Good evening, everybody. And to start with, I would like to thank the Indian Academy of Pediatrics, the Adolescent Health Academy, and Dr. Hima Bindu Singh, and all the organizers for giving me the opportunity to be here for this critical discussion. To start with, so I hope I'm audible now. Okay. So all of us are here on a common platform, and that itself speaks about this, the importance of this session, that how important the adolescents are for making the country's socio-economic development and the triple dividend potential which this population has. So by triple dividend, we mean that this population, the adolescents are our today, our future, and they have an intergenerational effect also. So investing in this cohort is the most advantageous strategy to be implemented by the countries and the nations. So talking about the global best practices which I have been assigned that I should be talking about that. So there are multiple global strategies and it's very difficult to summarize them in 5 minutes. But to start with, I would say that at the level of the strategies, the guidelines and the documents and the policy advocacy, if we see, then we have the Global Accelerated Action for the Health of Adolescents, which is formulated by WHO. And this guideline, this document tells how the national programming, the programming, adolescent health programming of the country should be, what strategy should be done. So what they do is they build an investment case. They first of all assess the baseline landscape analysis of the adolescent health status of the country. Accordingly, they decide what are their priorities, what should be the implementing actions. Then they implement those actions and then they do a feedback. They do an accountability measurement of whether their strategies were effective or not. So this is the Global Accelerated Action Plan. Apart from that, there is a global indicator for the measurement of adolescent health, which is known as GAMA, the Global Adolescent Measurement Indicator. And that is allows the indicators for on all the 5 domains of adolescent health, not just health and well-being. It's about nutrition, it's about resilience, it's about connectedness, it's about safe and supportive environment. So any country, any organization can take the help of these indicators to assess the status of the adolescent health and what needs to be done for the data for action plan. Then there is a global strategy for women health and children and adolescents. And there is, if we talk about India, we have the reproductive, maternal, neonatal, child, adolescent health strategy, which includes adolescent health as one of the priority areas. And then coming on to the UN, all the UN organizations had come together for making a health promoting school, if you have heard about it. It's about how can we make our schools more health promotive, not just for the purpose of education, but for the purpose of learning, for purpose of generating, empowering them with skills, with resilience, with making them more agile and more informed, and giving them a safe environment to grow. Coming on to the country-specific strategies, I would suggest, like what the guidelines say and what the governments are doing is, the strategies should be at 3 levels. So the first level is about providing universal health care through primary health centers and primary health care. Second is through the communities. Go to the communities, do community-based actions. I'll be talking in detail about that. And the third is what the school-based. So 3 basic actions which need to be done at 3 levels. Country-specific, first of all, I would be starting from India, which has done a great job in adolescent health programming. India has a National Adolescent Health Program, which you all know, must be knowing. It's by the name of RKSK, Rashtriya Kishore Swasthya Karyakram. It is a comprehensive National Adolescent Health Program dealing with 6 main domains of adolescent health. That is about sexual reproductive health, about nutrition, about substance abuse, mental health, non-communicable diseases, violence and injuries. All these are covered. And they basically target 3 main strategies. First is facility-based, which are the adolescent-friendly health clinics. These are the places where our adolescents can go in government setup. These centers provide all the services, commodities, and counselings for the adolescents of that community. We have counselors there. Then there are various school-based interventions, where like we have the weekly iron folic acid supplementation. Since 50%, 59% of our adolescent girls and 30% of our adolescent boys are anemic. So we have the weekly iron folic acid supplementation program. We have the menstrual hygiene scheme, which is for providing subsidized sanitary napkins and menstrual health awareness to adolescent girls. Then we have even the national deworming program comes under this. Then in the community level, if we go, we have the peer educational programs, which we are talking about, the youth engagement. We have the adolescent health and wellness days, which are celebrated every quarterly. These are known as the Yuva Samvad in Hindi, they call as. Then there are adolescent health clubs, where the peer educators, the concept of peer educator is that peer groups are the people from the same group of adolescents are selected, like 1 female and 1 male from the village, from each village is selected, and then they create groups of adolescent boys and girls who communicate amongst themselves about the stigmatizing issues, about the various queries which they have, and they have a cross-learning sessions. So these are known as peer education programs. Similarly, in the school health, we have the health and wellness ambassadors and health and wellness messengers. So the teachers, there are 2 teachers from each school who are designated as ambassadors, and there are 2 children from each class, 1 male and 1 female, who are designated as messengers. And these help in creating awareness and counseling of their peer groups. So these are the India-specific actions. India also has a dashboard, a digital dashboard for monitoring the activities of RKSK, and we have a school health and wellness dashboard. And these dashboards help in data recording and data-related action plans. Then we have the helplines. There are various helplines. There are state-specific adolescent helplines. There are suicide prevention helplines. Then there's a Telemanas, which you all must have heard. It's a digital phone-based mental health portal where the adolescents can approach. It has a chatbot also. It has a phone banking, phone call also facility. And then there is an app also. So adolescents can access there for any mental health issues. Other countries, if we say, then Nepal has done a great job in reducing the child marriages and teenage pregnancies. And what they have done is that they have implemented comprehensive sexuality education in school as well as in communities throughout. Apart from that, they have ensured that the adolescents, especially the girls, achieve the education to at least secondary level. And also, they have made the contraception access free, irrespective of any constraints, and they have made safe abortion practices free of cost. So that has largely reduced the burden of teenage pregnancy in Nepal. Sri Lanka, if we
Thank
talk
you.
about, they are very much into the youth engagement. They have technical advisory groups which are having quotas for youths to make decision making for strategic planning of the country's programs. Then they have the primary health centers approach for the adolescent health services. They also have the National Adolescent Health Strategy. And if we talk about Bhutan, they have changing rooms in schools for menstrual destigmatization. And there are various interventions which are being done by different countries, and they are very good interventions, which is difficult to summarize in this short panel. But I would say that all of us need to recognize through this forum that meaningful engagement of youth is the crux. We need to have their voices amplified. We need to realize that they need not be left out. They, although they are perceived as a group of healthy people, it's just a perception. We need to include them in all our services, make our services responsive and inclusive to their needs, make them culturally appropriate, effective, efficient, acceptable, and accessible to them, and ensure that their voices, which are calling, which say nothing about us without us, should be attended to. Thank you.
Thank you, Dr. Rachna. That was very comprehensive. And it does advocate what a wonderful and vast network you have, which reaches out to the grassroots and makes the adolescent the key point through which we propagate health. Thank you, Dr.
I think
Rachna.
we should give a round of applause to
Applause.
all those 7 years. I mean, the mere presence, the physical presence and the mere presence virtually or physically itself shows a commitment for this direction. Thank you so much.
We need to go through the entire panel. I'll request all the speakers to be as brief as possible. We have Dr. Navya Krishnan from AIMS Mangalgiri from the Adolescent Health Resource Center. So if you can please give your key learnings from whatever is your experience.
Can I have my PPT, sir? My PPT. It's loaded. Dr. Joe? Okay. Yeah. So I'm Dr. Navya Krishna. I'm representing the State Adolescent Health Resource Center, AIMS Mangalagiri. Since inception of, since 2021, we had established a State Adolescent Health Resource Center with the funding from UNICEF. And since inception of our center in our AIMS OPD, we were doing a lot of adolescent health related activities. Okay, not only counseling them, doing their, checking their growth monitoring, and we were counseling them regarding, we were profiling adolescent, adolescents living with HIV, we are profiling, and we were also developed various e-health modules for adolescents regarding early marriages, regarding menstrual hygiene, regarding we have domestic violence, we have nutrition, we have road safety, various modules we have developed regarding adolescent health. And we were counseling them, we were capacity building, regarding capacity building, we were training the medical officers, ANMs and CHOs regarding adolescent health, regarding the various modules. We were also collaborating with the state and district level health teams, and we were counseling the adolescents, and we have trained, we have a Sakhi program is being run in the Vijayanagaram district So this is a comprehensive adolescent health program, adolescent health and development program in Vijayanagaram district with the state support with the district administration. Yeah, we were developed a Saki corner we have developed for an adolescent purpose, and we are training the various Sakis, adolescents regarding that. And we were trained the around 10,000 medical officers and CHOs and ANMs under this phase 1, phase 2 under UNICEF Park project. Yeah, thank you.
Thank you, Dr. Krishnan. And you've been a very, very active partner. We really applaud this. And thank you for all the inspirational achievements which you've already showing us the light.
I
Thank
would
you.
like to add that we need more such centers in all over the country.
Yes, they would be a
Mangalgiri is
template.
doing an excellent job, and we require many more centers and resource centers for adolescents.
Let this
Thank
serve as
you.
a template for us.
Thank you.
Thank you. Uh, we have Dr. Srirang Apkeri from the Indian Medical Association who's been waiting for fairly long. Dr. Apkari, you've joined us online. Could you please put in your 2 words?
Good evening, sir. Thank you for having me here. I would like to congratulate the entire team for this wonderful simulation of this idea of adolescent health and getting all of us together on one common platform. I'd like to thank Dr. Vasant sir, the chair of this panel discussion, Dr. Bindu madam, who's been really the force behind this, and all other distinguished representatives. And thank you, Dr. Salima, for the wonderful coordination. From the Indian Medical Association, we very highly value this Hyderabad declaration. In fact, even yesterday we had our state president and secretaries meeting, wherein every state was actually encouraged to have this adolescent health programs. This is very vital. Already a few of our states and branches have an adolescent health committee, which is actually looking into that. And we also have a flagship project called as Aao Gaon Chale, wherein we adopt certain villages or slums and take care of their healthcare needs. And we would like to integrate this adolescent health initiatives into this Aao Gaon Chale project so that the existing adopted villages and slums where this is there, that can be taken care of. And to also further pass on this message, we'll be having regular CME programs on adolescent health. And 18th of every month and a week thereafter, we will have regular programs so that this multiplication of force will happen all across our branches, 1,800 branches. And I think we will contribute significantly in reaching our target of 1 million. Once again, congratulations and thank you for having me here.
Thank you, Dr. Apkari. The Indian Medical Association, being the largest organized association of medical professionals, would be the single largest instrument in helping us to reach our target. Thank you for joining us.
Having IMA on board, what else we want? It is the mother of all doctors associations,
Yes,
and a
ma'am.
very strong IMA presence, Dr. Dilip Bhanushali and sir, both of you. I really thank you that you are already started work on it, orienting your state branches and district branches on celebrating 18th of every month as Youth Wellness Day. I think all the organizations will follow you. Thank you so much.
Thank you. We now have Dr. Kadri, who is the past president of the IAPSM. Sir, could you please elaborate on how would you like to engage with the adolescents? What are your initiatives and what is your action plan on behalf of IAPSM for the 1 million target?
Thank you. Thank you for having me. First of all, it is very heartening to see that the commitment and this association has reached to this level. In fact, when I was president at that time, with the active interest of the Professor Sukanta, I think a series of the consultation has taken place. Then this association has converted into the declaration, and now I think we are talking about the action plans. I think it is really heartening to see that. So otherwise, always happens that the momentum always just built up and all is just fuzzled out. Good, thank. So I like to congratulate the entire IAP team for steering this initiative. Regarding the IAPSM, you all know that in fact we are largely involved into the public health. So we have already formed our adolescent committee, and we have planned that we'll be having the policy. We are preparing the position paper, and we'll be now preparing policy briefs on important priority areas of the adolescent health, Besides that, we are developing the resource tool. This resource tool we use for sensitizing the medical students with the support of the our state chapters and the faculties working in the medical colleges will be sensitizing the medical colleges. And besides that, in fact, we are also developing a resource tool for the we are giving the target to the all interested medical colleges. We have set the goal to have the 100 medical colleges, minimum 100 medical colleges who will be taking up the adapting 10 schools in their RHC, USTC area or nearby vicinity, and they will be carrying out at least 10 sessions, will be carrying out 10 sessions for the adolescents educations and the health promotion. So as of now, what we have planned about. Thank you very much.
Thank you so much, Dr. Kadri. Dr. Aarti Gupta is online. She would like to share a few slides about the work that is being done at AIMS Mangalgiri, which would serve as a template for other institutions to follow. So, Dr. Aarti Gupta.
Hello, everybody. Good evening to all the respected dignitaries on the dais and off the dais. I, Dr. Aarti Gupta, we are having State Adolescent Friendly Health Resource Center, which is being supported by Rashtriya Kishore Swasth Karikram. So first most, I will like to highlight one part. Standalone centers may not be able to services. So whatever centers or initiatives are going to take place, we feel that it will be good and essential if the government organizations, those who are involved in this, are linked and supporting us. So the State Adolescent Friendly Health Resource Center in AIMS Mangalgiri is recognized by RKSK as official center for the state. And also we are working very closely with ICDS under Kishori Vikasam program, with Department of Education, Samagra Shiksha and Social Welfare Schools, and with under midday meal schemes. So we and with Andhra Pradesh State AIDS Control Society for HIV adolescents living with HIV. So we are having a very well networking with all the government partners also, which brings State Adolescent Health Resource Center with support of UNICEF to this stage. So there is a lot of hard work of 4 years which has been put in to present it. So, and also along what Dr. Navya has said, in that I'd like to add, we also provide a lot of inter-college collaboration also. If a single department is going to start it, it may not be very useful again, because these adolescents may have any specialty disorders or diseases or morbidity. So especially when it comes to super specialty. So tertiary care institutes can work as a bridge to provide these adolescent healthcares at low cost, which is not available in many of the medical colleges or tertiary healthcare institute at low cost. For example, AIMS Mangalgiri is having a highest rate as of AIMS Delhi, which is at very low for surgery. 5,000 you go for high-end surgeries. So in this way, it requires both intra-institutional and interstate and maybe at national level. Collaborations are needed at all the levels to give healthcare to the adolescent. And thank you for the opportunity. We are open to collaborate, to provide service, or to work with all the organization. And I hope we will connect and work together in this line for better adolescent
We
health.
promise to
Thank you.
do that, Dr. Aarti. Thank you, and we really appreciate your efforts. May we now move on to Dr. Neelam Agarwal, who is the president of the Stillbirth Society of India.
Hello. So if initially it may just seem what is Stillbirth Society of India doing with adolescent health, right? But yes, if we think that today's youth is tomorrow's parents, then it makes sense that Stillbirth Society of India should be actively engaged in adolescent activities also, because our core mandate is stillbirth prevention. And poor nutrition, anemia, lack of reproductive health awareness, early marriages, all these are the adverse factors for stillbirth. So by engaging adolescents, Stillbirth Society can strengthen primary prevention of our core mandate, prevention of preventable stillbirth.
Yes, ma'am. Where prevention is the word now.
Yeah, prevention is the word. And our vision is healthy adolescents, healthy mothers, and prevention of preventable stillbirths, zero preventable stillbirths. So that's our mandate for with adolescent linkages, and we will link by way of focusing on the preconceptional health, safe motherhood, and intergenerational impact. So ours is a very small, young society with small, limited number of members, but we will definitely collaborate with all our sister organizations in all the activities mentioned, and our smart aims are education, awareness, providing the services by screening and health camps and peer educators, capacity building, and all the whatever activities have been described in the Hyderabad Declaration. Stillbirth Society is committed and affirms its commitment to work with all the organizations and partners in achieving this adolescent
Thank you
wellness
so much,
as
ma'am,
they-
for your commitment and for reiterating whatever you had talked about previously. We will now move on to Dr. Santwan Mehta, who is representing Foxy and will be one of our very, very key partners.
Thank you very much, sir. Good afternoon, everyone. It's an honor for me. I'm Dr. Santun Mehta, representing the Foxy at this very nice gathering regarding the adolescents. So we do understand, and we have been we have been told very nicely that the adolescence is a very important phase of our life, and so the Foxy has always understood the need of taking good health uh, care of the adolescent people. So we have a dedicated adolescent health committee which takes care of various activities, like we do promote the menstrual health awareness and the sexual reproductive health awareness by going to different schools and colleges. Then we do take up time to time skill building activities, so for the healthcare providers, so that these sensitive informations can be provided and given to the adolescents in a very polite manner. Then we do have nationwide camps to take care of the mental health issues, sexually abuse issues, and substance abuse issues. Then we have also dedicated committees for the endocrinal problems and the endometriosis problem. Recently, we have launched Sampurna project, which is Sampurna project is dedicated towards the nutritional deficiencies of the adolescents, as we do know that more than 50% of the adolescent girls are suffering from the anemia or some sort of malnutrition. Then we do have a sexual transmitted infection committee, which gives a proper education regarding the safe sexual practices, use of contraceptive and acts and all those things. And in the coming November, we do have our presidential conference where we are going to launch a specific sexual education comprehensive module, which will which will teach all the 50,000 gynecologists across the nation regarding the safe sexual practices, and then they themselves will spread their knowledge to each and every needed schools and colleges. So thank you very much for having us with
Thank
you,
you.
and we are
A round
always
of
a part
applause,
of that.
please, for Foxy for joining hands. And let me reiterate to the audience, this is a long-term commitment. We want it for a minimum of 5 years. Hopefully, we'll be able to take it to the next 25 years of the HA. And who better to reiterate this commitment than the President of the Indian Academy of Pediatrics, Dr. Vasant Khalatkar, to put in his final words, and then we have a surprise in store.
Yeah, uh, I, I bring greetings from Indian Academy of Pediatrics as largest, second world largest organization of academics. That's more than 49,000 member, second world largest. So, what is the strength? You can understand. So, and you heard Dr. Hima Bindu is a vibrant worker, along with Dr. Bansal, Dr. Tuteja. These all people are working really so hard, and our Adolescent Academy really doing a lot. Basically, I think, as per my knowledge, adolescence empowerment, youth empowerment started by IIP. Though it was a part of IIP, but we thought that there is a need of joining everyone. That's like UNICEF, POXI, WHO. And this year, I tried to invite. Of course, POXI also joined this year with our this Sumin project, and Dr. Bhanushali welcomed this idea to join that this unit. And this is our first project. You might be knowing Dr. Sukanta is there. our child sexuality initiative. We are
Yes,
doing
sir.
a lot. So what is what we believe as a pediatrician? We never believe in just talking. We want to be in initiation. This is very important that you should act fast. Like we pediatrician going to classes, going to students, and so many branches we are having. There should be all the decentralization, and there should be more and more power. Thank you, Foxy also, IMA and PATH, all these organizations for helping us. But if we act jointly, it is definitely going to happen. And what is my important message is that we have to reach periphery. What is happening? All these programs are on paper and everything. See, everybody want publicity, paper media and everything. But why to use this publicity media only for our promotion, not to give the good message? See, suppose Vasant Karatkar write the good message for a community, automatically the name goes. And that's why IAP is doing that. IAP ke baad community ke saath. We are giving so many good messages for this. And this Hyderabad Declaration Initiative, one of the
Yes.
part that. And what is my important message? It's not the youth. It's you have to talk with parents. You have to talk with community. Mama, Mosi, Kaka, Kuku. There should be a group of those people. They should train their
Yes, sir.
youth. घर में से youth को empower होना चाहिए. That is very important. And that is our motive. I request all these esteemed organization, all those my friends, please help us in this initiative. Then only we will be successful. Otherwise, it's not only job of IAP, it's a job of all the will.
So
Thank
charity
you,
will
UNICEF.
begin from
UNICEF,
home.
thank you.
Yes,
Thank
sir.
you.
Sir, I think we're looking forward, sir, IAP's commitment to orient all the state branches and district branches in this initiative of reaching out to 1 million adolescents, all of us here together. And we need to orient towards the 18th of every month of Youth Wellness Day, sir. Thank you.
So may I finally request Dr. Vasant Kalatkar to please come up. There is a website on this Hyderabad declaration which has been created, and we shall be sharing the QR code on the screen. Can I request everyone to please share the QR code on the screen, please? All of you can scan the QR code and you will enter that particular website. So please declare it open.
So one of the commitment from IAP is that about the Hyderabad declaration, what Dr. Hima Bindu declared, that we are going to commit that we will have an orientation program for all the district branches, not only district branches, all 365 branches we are having. We are going to orient so that it will go to periphery also. Thank you.
No, yeah, just a minute. Can I have someone from the technical team just come?
And one more thing that this project should not be like that ki Vasant Kalatkar gone, next year somebody is there, like Dr. Hima Bindu. It should be continue at least for 5 years. I really hats off to Dr. Bansal, that mission Kishore, and this project is still, we remember and we are continuing that project. Project should be like this.
This
That's
proj-
why.
Yes, sir. Hyderabad Declaration project we'll be doing for 5 years.
5 years.
And so that we see some impact. And the promises
I
to
know
reach out
once
to.
there is an impact for 5 years, it is going to continue. So many programs in IAP continue because of its impact.
The tech team, anything? We are short of time, so please help us. क्या हो रहा है, शामिक?
If the tech team,
अभी open होगा, उसमें भी लेना.
I request the tech team to share my screen. The website is visible on my screen if they are having challenges.
So this is the website of the Hyderabad Declaration.
It's open.
Yeah, I'd request Dr. Vasant Kalatkar to announce.
I declare that this website is open for all. Kindly check where is the QR code? Is there? Already. Okay. Thank you.
Yeah. Reached out to 67,500 adolescents. So the adolescents can reach out to this directly. It's a collaborative effort. And we are uploading our videos. All the presidents and chairpersons have uploaded their videos and message. Thank you.
So, and one also you must be knowing that we are having very strong media that Adolescents India, Dr. Tuteja is running that column. Really, it's very effective to read the.
So we end this program with a huge, let's give a huge round of applause to this whole initiative, to all the stakeholders, and having joined hands, let us pledge to continue this initiative for as long as we can.